Welcome back, Titans, to another episode of EMS Lecture Series for St. Pete College's EMT and paramedic programs. We're in respiratory today. It's one of the most common causes of us getting called out to a scene: respiratory illness, disease, shortness of breath. So we're talking about pneumonia today. What it is, the stages of it, how we can help our patients in the field, and ultimately what's going to be their long-term care in an emergency room or a hospital facility. So what is pneumonia? So pneumonia is an inflammation of the lungs caused by bacterial, viral, or fungal infections, or infections with other microorganisms. So far, they found over 30 different causes of pneumonia and how it's developing in the lungs. So it's pretty prevalent. It was actually first described in 400 BCE and remains one of the most common fatal illnesses in developing countries. So here in the United States, annually, we have about 50,000 patients die from pneumonia. So let's learn how to take care of our patients, how we can identify it, and so forth. So during our initial patient assessment, we get called out to the scene for shortness of breath, coughing, fever, any multitude of signs or symptoms. So we respond to a respiratory distress call. Let's say our patient is at home and has had respiratory distress for the last 1 or 2 days. Signs and symptoms can be cough, fever, maybe even chest pain from coughing, sore throat, all these different things. So we want to appropriately assess our patient. We're going to get a full set of vital signs. We're doing our sample, our OPQ-RST. We're going to hook our patient up to the monitor, and obviously anytime we have a respiratory call, we're going to get our nice end-tidal CO2 on. Let's rule out bronchospasm and see how their lungs are doing with our oxygen saturation, end-tidal CO2, and obviously a 12 lead and 4 lead and all that fun stuff. So when pneumonia starts, this is going to be a slow process. This is not going to be like your asthma patients that have asthma exacerbation or an asthma attack that happens within minutes. Pneumonia typically is a slow developing infection that goes over the course of days or even weeks. So that's another thing to cue in when you're performing your assessment and asking your patient questions. Now, when inflammation occurs, it can develop either one side in one lung or on both sides in 2 lungs. For this, we're going to say it's in the lobe of the patient's right lower lung. So when you're listening to lung sounds, we're going to listen to the apex, the bases, we're going to listen to the back. If you hear a slight rhonchi or something odd going on in one lung and the other lung is clear, that may be an indicator or a red flag that maybe there's an infectious site in one lung and maybe this is pneumonia. Our patients could present a million different ways. They could have a fever, they could not, they could be coughing, they could not, or it could be severe to where they're severely hypoxic or even sepsis. So when pneumonia occurs, it can cause tissues to swell or become inflamed and cause fluid and pus in the lungs. And our bacterial infections are typically more severe. So we have our alveoli here. So once the infection starts, it starts filling our alveoli with pus or fluid. We know that through the bronchioles and into our alveoli, that once our air sacs of alveoli become inflamed or filled with fluids, it diminishes our gas exchange, our oxygen and our CO2 exchange. This is where the patient starts to cough and our O2 sats start to drop and we don't have appropriate gas exchange, so that's going to cause an issue. What are the 4 stages of pneumonia? So our first stage is congestion. So congestion is where the alveoli and the capillaries become inflamed and filled with that fluid. Like I said, this is usually in the first 24 hours. This is where our patient could have a fever, they start developing that cough, they start feeling lethargic, they don't feel very well. Moving on from congestion to the second stage. Now, red hepatization is our second stage of pneumonia. This is where the red blood cells and other immune cells are directed to fight the infection in the lungs. So red blood cells, other immune cells are going to fight our nasty infection in the lung. It's called the red phase because now as the red blood cells go into the lungs start to become dry and firm at the site and extend out, and it kind of resembles a liver, and the color of the lungs start becoming red because of all the red blood cells. This is usually 2 to 3 days into the process. Hopefully by now our patients called 911 or seen their primary care, gone to the hospital to be evaluated and treated. If they have not and it has gone untreated, we're going to move into the gray phase. Now, the gray phase is just like the red phase, but it can now the blood cells are beginning to break up, and now the lungs are turning from a pinkish or red color to now a gray color. Now, this is the third stage in the gray phase. This is the severe phase. This is when our fever is continuously going up, our cough is getting worse, our lungs are drying out even more, our gas exchange is terrible, and now the lungs are going to start to becoming gray. In this process, now that the red blood cells are starting to break up, you may see your patient coughing up a little bit of blood. Hopefully they've gotten treatment by now. If not, this would be the phase we find them in. And then the fourth phase is obviously resolution. Resolution is the phase in which now everything's taken care of. The pneumonia has passed. They've received antibiotics or something from the hospital. There could be a number of different days in between, or even weeks between the third and fourth phase of treatment. How are we going to help our patients? Obviously, we've done our assessment. We're going to provide supplemental O2 for our hypoxic patients, maybe a position of comfort. We need to continuously reassess their breathing, O2 sat, end tidal, and airway. Make sure that we're not going to lose the airway and that they're getting enough positive index expiratory pressure, that they're getting their oxygen saturation is good, and we don't have to perform any invasive procedures. Once they get to the hospital, the end-all be-all for pneumonia is eventually how we need to fight it with antibiotics and probably corticosteroids for the inflammation. So this could be from a number of either days or even weeks that they are going to be either hospitalized or being treated. Typically, it's about 10 days worth of antibiotics. Once the patient's stabilized and able to remove themselves or get out of the ER, but it could be even longer for severe cases or in the cases of pediatrics or our geriatric patients. So, quick overview on pneumonia. Make sure you're looking for our sepsis criteria, control the airway, make sure our saturation is good, and reassess your patient frequently.